President Paul Kagame applauds the role of community health workers in taking care of the people's health and ensures that the necessities will be provided for them to fulfill their duties effectively. This is as on Saturday the head of state met with over 8,000 community health workers. Prince Manzi has the details.
The Meet the President event took place in BK Arena and convened community health workers, hospital directors and partners of the health sector. Dr. Sabin Sanzimana, the Minister of Health, reiterates that the community health workers have spent 30 years following up on the health of the citizens.
Hari indwara ya malaria. Abanyarwanda 2 kuri 3 barwaye malaria bavurwa n'abajyanama b'ubuzima.
For malaria, 2/3 of Rwandans with malaria are treated by community health workers. They have been doing this for 30 years, and the response was a 90% decrease in its patients. We used to record 6 million Rwandans contracting malaria annually, and now we record only 500,000. And though our hospitals are no longer receiving patients of malaria in critical conditions, Your Excellency, they do not work alone. They collaborate with health centers, providing equipment and pieces of training. President Paul Kagame applauds the role of community health workers and the effectiveness of their work. For our country, having unhealthy citizens, there is no future. All bases on life and being healthy. For working, whether you are a farmer, you cultivate only if you are healthy. Be children, for them to be Rwandans willing to develop themselves and the country, they have to be healthy. It all begins there. Some of the community health workers take pride in what they have achieved and have some recommendations. As community health workers, we struggle with reaching the health centers as well as our patients. And we would like, Your Excellency, if possible, to be facilitated in transport. The head of state comments on the recommendations of these health workers. Skilling you up for you to work comfortably and effectively. And on that, the ministry in charge and other partners, we are to find means that each on one's level can be trained. It is not dreams, but rather applicable. It will be done. I said pieces of training. I said also about salary. We are to find means amidst our capacities, but we must multiply things. In Rwanda, there are currently 60,000 health workers. The Ministry of Health demonstrates that through the 4x4 program in 2028, there will be 32,000 more personnel in the health sector, and they'll collaborate with community health workers in serving citizens. Prince Manzi, All TV News.